like to now introduce our next speaker to talk more about this wonderful collaboration. He is a man that will be very familiar to a lot of you. For the past 20 years, Michael Camit has been researching, developing award-winning multicultural health communication campaigns. He is also a PhD candidate at the University of Technology, Sydney. He's very passionate about co-creating and co-designing initiatives with diverse groups and researching social media to contribute to empowerment and health outcomes of migrant and refugee families. I also understand he possibly has a doctorate in karaoke. He loves a bit of a song. Please join me in welcoming to the stage Mr. Michael Camit, Acting Director of MHCS.
So one of the rules in karaoke is make sure that your microphone is closer to you. So thank you for that. I wasn't in your speech. No, well, thank you, Janice. It's always great to see you as 8 years now, part of the Multicultural Health Week tradition or family. Welcome, everybody, and thank you for attending, and thank you for Southwestern Sydney Local Health District for hosting today. Dr. Kerry Chan, distinguished guests, ladies and gentlemen, I also would like to begin by acknowledging the traditional owners of the land on which we meet today, the Darug, Tharawal, and the Gandagara people. We pay respect to the elders, past and present. I also would like to acknowledge people from migrant and refugee backgrounds who have come from all over the world to make Australia their home and contribute to our rich multicultural society. Our Southeastern Sydney Local Health District is very proud to host the New South Wales Multicultural Health Communication Service, or MHCS. MHCS has led the coordination of Multicultural Health Week, as Janice mentioned, in collaboration with the New South Wales Ministry of Health and the various multicultural health services across local health districts. Mr. Tony Jackson, Acting Director of Primary Integrated and Community Health, or PITCH, of Southeastern Sydney Local Health District, sends his apologies today, as for most of you, you know it's the first day of accreditation of the district. On his behalf, I'd like to acknowledge Catherine Clinch, who's the Acting Deputy Director of PITCH from the district, who's representing the district. Now, as Janice mentioned, well, there is a role for the 3 Ds, dance, dress, dinner, or I would like to add a 4th D, which is decoration. You know, for those of you who've been around Multicultural Health Week, well, those are expressions of culture. Multicultural Health Week has evolved to become an event that brings New South Wales together to celebrate the work of various individuals and organizations and focusing on a particular theme and highlighting some of the challenges. A major outcome that resulted from Multicultural Health Weeks or the past weeks has been the strengthening of strategic partnerships. It's about the networking with not just MHCS, but also various health services in the community, such and peak bodies like the Clinical Excellence Commission, the NPS Medicine-Wise, the Australian Commission on Safety and Quality in Healthcare, CARES New South Wales, and many others. So if you look at the themes for the many years, we've been able to actually work together on those particular themes. MHCS has also raised the profile of Multicultural Health Week, focusing on key health issues through news features on national mainstream media and multicultural press, reaching Australians from diverse backgrounds in New South Wales and across Australia. Multicultural Health Week is also included in the New South Wales Health Calendar and actually actively promoted on the MHCS website, media and partner networks, as well as on social media platforms. The Multicultural Week website is an effective online tool that showcases translated information highlighting the theme for the year, which the health workers and communities find very useful. At this stage, I would like to acknowledge the valuable work of Peter Todaro, the former Director of Multicultural Health Communication Service, who retired from his role this year. It was his vision to ensure Multicultural Health Week become a recognized annual platform to raise awareness of CALD issues in the health system at a statewide level. I'd like to thank the Ministry of Health and their support and trust in MHCS in running the week. Now, if I can do it. And there's the 2 slides of these. I'd like to particularly thank for this week the work of the advisory committee for dedication and their passion and lively discussions about where the theme and the toolkit and a lot of the resources that you will have. And ensuring that health literacy is related effectively in the resources for this year's Multicultural Health Week. The support of the Multicultural Health Services in the local health districts, refugee health and the pillars, the Agency for Clinical Innovation, the Clinical Excellence Commission for this year is invaluable. So that's a lot of thank yous, but now let's look at the theme. So, sorry, I should have not done that. Key factors we highlight this year that can influence a person's health literacy are culture and language, as Janice mentioned. In 2016, almost 3 million Australians aged 15 to 74 spoke English as a second language. However, Adult Literacy and Life Skills Survey found that only 25% of the group had achieved a level of individual health literacy as adequate or better compared with 44% of people whose first spoken language was English. Language and culture affect the way people make meaning out of their experiences and influence their moral and emotional responses to physical and psychological conditions. This can lead to different cultural expectations and understanding of health-related issues. So, that's a slide. MHCS, in partnership with the New South Wales Refugee Health Service, has recently completed a photo voice project with refugees from Syria and Iraq to understand how they experience the health system. So for those of you not familiar with the technique, with photo voice, it's a process where community members are given a chance to identify, represent, and enhance their community through a specific photographic technique. It was developed in the 80s and late 80s and early 90s using disposable cameras. This year, we have updated the technology and asked participants to use their smartphone cameras. Almost everyone now has a smartphone camera and has a smartphone and has a camera. The power of this method is not necessarily about the photographs, but in the stories and the discussions that actually occur when people share their photographs, both with co-participants, but also with health service providers. So we're planning an exhibition in around October this year, but I just thought I'll give you a little peek about some I think was one of the powerful images. So this one is a photo taken by one of the participants. She was visiting another Syrian refugee, a man in his 60s, who did not have a family in Australia. This is a photo of the food that gets delivered to him at the hospital. So when asked what was happening in the photo, the participant explained that her friend lost weight in the hospital as he would fall asleep when the food was being delivered and as such would not be able to eat. The participants and friends raised the issue with the staff and also with their friend, and the issue was resolved immediately. But as was mentioned earlier, health literacy, this highlights the need for to work both with the individuals and the system, but also with acknowledging that the health literacy of his friends or support system. So whilst this year the focus on health literacy is in the context of healthcare, and the other speakers will be highlighting this, we also want to acknowledge the role of health literacy within the population strategy for health promotion. So in a recent paper by Professor Don Nutbeam of the University of Sydney, who has been researching health literacy for many years, he suggests that as education is the main route to improve literacy in populations, it would follow that organizations that organized and structured health education will improve health literacy in individuals and populations. Health education is most likely to improve health literacy when messaging and delivery are tailored to the specific language and cultural needs of the population. So as such, I would really encourage you to look at the posters outside, because it's a mix of healthcare and population health, where health literacy fits in. The poster exhibition outside is the first time we've actually run this to reflect some of the work some really good work that's happening across New South Wales with health literacy and communities from culturally and linguistically diverse backgrounds in both healthcare and population health. So in addition, as mentioned, there are resources including an online toolkit developed for Multicultural Health Week, which was developed to help address and raise awareness about these factors for health workers working with multicultural communities. Thank you to my colleagues at MHCS, and special mention to Sam Shen. Where is Sam Shen? Raise your hand. Sam, who coordinated Multicultural Health Week this year, and Jess Hellaratne, our media manager. and of course the rest of the MHCS team. Every year at this event, we hear of people connecting with others, which often results in collaboration and engagement with health and community stakeholders. So I encourage you to meet new people during food, by looking at the posters. Meet new people, new organizations, and collaborate and engage, and talk about the current and future initiatives. The people who are here are very passionate, about health literacy and multicultural communities. Explore ways of improving the health literacy of consumers from culturally and linguistically diverse backgrounds and the health service environments. Thank you.
So one of the rules in karaoke is make sure that the microphone is closer to you.